Good morning, good afternoon, and good evening, depending on the places where you are. My name is Amos. I'm a resident eye specialist at St. Luke's and Orthopedic Hospital in Eldoret. Let's discuss about low vision awareness, and we are going to discuss about conditions that causes low vision. Low vision, these are the cases that we are going to look at. What is it first? What's the definition of that? Low vision is an impairment of vision. It is an impairment of functional vision that we use to see. And we have a grading. We grade based on the visual acuity. So every time you walk into an eye specialist, they always check your vision of each eye independently. That is the right eye. Start with the right eye, then you move to the left eye. You look at that chart, we are able to tell you you are reading up to this level, up to this level. So in low vision is the vision that comes less than 6/18 to 3/60. That ranges. That is after the correction, after the spectacle correction, after the surgical correction. Yes. Also, when you look at the WHO classification, we use the classification to show the normal vision. So before we know the impaired vision, what is the normal vision? The normal vision is a vision that comes up to 6, that you're able to read those small letters all around for both right and the left eye. But now it comes to, we have circumstances that the eye itself cannot reach that level. So now that's when we say low vision after the correction. That is 6/18 to 6/60. That is visual impairment. Moderate, we have severe visual impairment that lies between 6/60 to 3/60, severe visual impairment. And blind but still perceives light. That is 3/60 to 1/60. And finally, we have the total blindness that comes to no perception of light. What are the conditions? The conditions that causes low vision can be categorized into two: the congenital and the acquired. So congenital conditions such as cataracts, these are the conditions that somebody is born with or later on develops before the age of around 15. So we have conditions like cataracts, retinitis pigmentosa, ocular albinism, that is deficiency of the melanocytes. Retinitis pigmentosa is a condition that affects the retina where there is a deficiency of the rods. Those are the gives us the vision at night. Cataracts is opacification of that lens or cloudiness of the clear lens of a human person. We have congenital glaucoma. A child is born with high increased intraocular pressure. Those are a few. We also discussed about the acquired. These are acquired. That means we acquire in the environment that we live, conditions that a person develops later on in life. That is, for instance, we discussed about the diabetes. So diabetes, that is increased sugars in the body. That is increased we call it hyperglycemia. Uncontrolled or poorly controlled sometimes or undiagnosed can bring the condition that affects the retina, affects the lens, and some parts of the anterior chamber that brings the iris, that brings about neovascular glaucoma. We have also conditions like macular degenerations, optic nerve head diseases, and some cases we have vitamin A deficiency that brings about corneal scarring. What are the signs? Signs can be as distortion of vision for both near and distance, restricted visual field, so the person is not able to see the peripheries, the center part, or overall cannot see clarity, so that brings about a blurry vision. Some cases has difficulty in performing his or her daily activities independently, so it needs assistance frequently. Sometimes they say, help me read, help me do that. That shows that this person might be help at the eye department. Yes, so how can we categorize vision loss? Vision loss can be categorized into three. One is overall blurry vision. So the whole part where the person looks at is not clear. I'm not seeing clearly. I'm not seeing well for the whole environment. Others also talk about some parts at the center I'm not able to see why. So they find they are tilting their head. So we have head tilt, or yes, that is for the center. And or when they want to pick something, they pick all the things at the peripheries that are at distance and leave something at the center. That shows that this person is not able to see centrally. We have also peripheral vision loss. So at the peripheries, periphery is now far to your arms. We call it periphery. So once the person is looking straight and unable to see the object coming into their visual field of vision, that's what we call peripheral vision losses. And the condition that I've discussed can cause that. As you can see, I've put 3 pictures here that shows overall blurry vision, center, parts of loss vision, central vision loss, and periphery. So the person is able to see at the center, but he bumps into objects all the time. Management of these patients involves teamwork, so involving visiting an eye specialist first, so that this specialist examine you comprehensively, find out what is the problem, and discusses the management, whatever levels these patients are. So the modalities of management involves around 3 of them. We have medical, that involves treatment. You give treatment in terms of drugs. For instance, vitamin A, you supplement the vitamin that is deficient in the body. If a case has been determined to need surgery, so surgery will be recommended by that specialist whom you have visited. And rehabilitation involves now supporting this patient to live independently, to live a quality life which is independent. So we refer to rehabilitative services for orientation and mobility, among others. And for successful, it needs a team, as I've said. It needs teamwork of eye specialists, teamwork of caregivers, and teachers plays a very big role. We applaud you because you diagnose problems that the doctor comes and confirm. For children in school, those are coping notes. You might say this child is doing minimally well, and you know the potential of that child coping from the fellow student. That shows that this child needs to be assessed by an eye specialist. Thank you for your listening, and we're looking forward to produce more content to educate you and empower you. Thank you. Have a pleasant morning, evening, and afternoon.